evening, and welcome to Future Choices. My name is Fran Snedeker, and I am the producer and moderator of this educational series, Exploring Reproductive Health Issues. Today, I want to introduce to you a small but amazingly energetic organization who for nearly 60 years has been striving to eliminate hunger, poverty, and disease in the poorest, most remote villages in Asia, Africa, and Latin America. Through their efforts, World Neighbors is helping to transform the world into a neighborhood. Please join me in welcoming Melissa Haley. I'm so delighted that you were able to join us here this evening, Melissa. In a nutshell, please tell us who is World Neighbors?
World Neighbors is an organization that partners with very remote, extremely impoverished villages around the world, villages where people are living on less than $1 a day, where hunger is oftentimes a problem, chronic hunger, and where disease and lack of access to health care are what life is like. And World Neighbors engages in a partnership with those villages for a long time, for 8 to 10 years, helping them identify their difficulties and begin prioritizing them and solving them with our technical assistance and with our training and with our facilitation. So World Neighbors is not about giving away stuff. Instead, it's about investing in people and training them to solve their own difficulties. And so it's sort of a two-track program. We're helping people meet their basic needs, but we're also training leaders and organizations in these communities that will keep the work going long after we've left.
Mm-hmm. That conceptually sounds wonderful, but just to get a better feel for what you're talking about, maybe you could stuff us into your suitcase and take us back to Africa, where you were last summer, I think?
Sure. I had the honor of visiting Kenya and Tanzania last summer and leading a group of supporters from the United States to view 3 of our partnerships in those countries. The community I'd like to talk a little bit about is Kitui, which is just southeast of Nairobi. And this is an area where World Neighbors partnered for over a decade with the community there, and for the past 3, now going on 4 years, the community and the organization that we were mentoring is now an independent NGO or nonprofit organization.
So it was basically an NGO established by through the tutelage of World Neighbors?
I believe it was in existence, but it wasn't focused on a broad-scale development in that community. We'll often partner with organizations that are maybe focused on one particular issue, such as HIV/AIDS or orphans or water or erosion or whatever the community has maybe already begun organizing around. There's some history of that in East Africa. In other countries and areas where we work where there isn't that history of community organizing, we will begin an organization from scratch. So in Kitui, we visited a former program, and it's this nonprofit organization run by a very dynamic woman, Janet Mumu, who's the CEO of the organization. And Janet was a farmer when we started with her, and quite poor and hungry, and she stepped forward to learn from World Neighbors initially when we started, and then became a volunteer agricultural and health promoter, and then later actually joined the staff of our partner organization and ultimately joined World Neighbors staff, and now she's running this thriving organization that is adding staff and programs and doing all kinds of really exciting things. So they are, for instance, working with sunflower seed processing to create oil, which is a staple of the diet in this area and yet had previously been bought from another area in Kenya. It was thought that sunflowers couldn't grow in this part of Kenya, and so one of the things World Neighbors did early on was provide some seeds to experiment with and see if that was really true and if the community could save the money from importing that oil, and it's worked fabulously. They're also doing things like working with...
Now, back to the sunflowers, was that the problem that the village identified? Let's start with sunflowers.
Typically, and again, this is our approach is that the village and the community is leading the process. Typically, communities start with food production, and because they're generally hungry for 3 to 6 months out of the year after the harvest has been eaten, and they're planting and waiting for the next harvest, and also generation of income to purchase food in those lean months. And so sunflower processing was probably one possible activity that we offered to them as something to try, both in terms of providing a staple food, but also in terms of saving that, 70 Kenya shillings a month or whatever that family would normally spend on that. And that's money then that can be used for extra food or for health care or for, helping a child attend school and that sort of thing. So increasing income and food is usually the first thing that communities want to approach, although every community is different. Sometimes water, dirty water and health concerns. Again, we're engaging with communities for 8 to 10 years, and so over time we sort of end up addressing the entire basket of interrelated problems. But again, the community, you're correct, is in the lead. So they may come to us and say, food production is a problem, we're hungry, and we may suggest things that have worked previously in other communities in Africa without coming in and saying, this will work and we know best, but rather giving them the tools to experiment and see what works best for them. And so sunflower seed processing, they also have begun raising dairy goats, and dairy goats provide very nutritious milk, particularly for children under 5 and for women that are lactating or are pregnant. And also this community is very focused on supporting HIV/AIDS orphans in their community, of which there is a great many. The areas that we work in Kenya have about a 22% HIV/AIDS infection rate. So it's a serious problem, and the organization that we sort of trained and mentored is now partnering with other community organizations and bringing them along. And one of those organizations was formed to take care of AIDS orphans and is now learning a larger basket of development activities.
Now, does that involve community education about prevention of HIV/AIDS?
Yes, it involves training community health workers, typically women, but sometimes couples and sometimes men. In some of the villages we visited, it was about 8 women to about 2 men, and they travel to, in Kenya anyway, 4 or 5 villages, providing education not only on HIV and other sexually transmitted diseases, but also safe motherhood, family planning, hygiene within the home, water sanitation, really the whole basket of what we call community and reproductive health. And this community in Kitui has done some really interesting things. They held a fundraiser to raise monies for school uniforms for the most vulnerable children in their community that would otherwise not have money for school uniforms and then wouldn't attend school. And you and I have attended more fundraisers than we'd like to think about. I started raising money for whatever charity with a fair when I was just a child, but fundraising is not part of the culture in rural Kenya at all. So people raise money to help bury their dead. And so what this community organization did was they thought, well, we're going to follow the same format and we're going to raise money for these uniforms. And so they printed cards, as you would if someone passes away, and spent one day distributing the cards and asking for donations. And they raised enough money to buy school uniforms for 57 children.
Wow.
And to provide scholarships to secondary school, which is $300 or $400 a year in fees, for some of the girls in the community. So really very powerful grassroots empowerment of people. So that was one of the things that it was great fun to hear about. And they had the list of the children that had received the uniforms up in their one-room office. So.
Now, you were talking about 8 to 2 ratio of women who were a part of this movement. In Kenya, as I would think in most of the places where World Neighbors works, women's social status is pretty low. Well, are the men not upset that you're empowering the women in this way? Taking them out of the house or out of the hut and away from the fire and away from the children and doing men's work?